Welcome to MedHeads, the weekly show that brings a biopsychosocial focus to issues of the day, along with special guests who will showcase their expertise and enthusiasm about their field of practice. Your host, Dr. Fergal Armstrong.
Hello everyone, my name's Dr. Fergal Armstrong and welcome to this MedHeads episode. We're very lucky to have with us Maree Eisma. Hello Maree.
Hello, hello.
So Maree, I thought today we'd talk about the impact that COVID isolation has had on our society. And from your perspective as a mental health social worker, I'd be very interested to hear what your experience has been.
So some of the things that I've certainly seen, and so have a lot of my colleagues, my psychologist friends and family therapists and other fellow mental health social workers, the impact on relationships. That's probably the first really big observation that I've noticed with the client presentations.
So impact on relationships, tell me more about that. What do you mean by that?
So when we were approaching lockdown, there was many people who thought the prospect of having to remain under the same roof line as a partner who they'd been having some, turbulence with in recent months or years actually became a major catalyst for people to leave their homes. Like some people actually knew that the prospect of being locked in with their partner was going to be like, too beastly to contemplate. So some people actually made those as use that as an opportunity to make a line in the sand and actually end their relationship. So that's the one thing. The other ones I've actually seen have actually where they decided to separate once we got out of lockdown. So we've had some tumultuous things going on in the home. I know I was only talking to someone the other day, and the amount of IVOs, the amount of stuff going through courts in response to family violence absolutely, skyrocketed.
Yeah. And there's also the issue of domestic abuse and violence, isn't there? So you're stuck with an abusive spouse under the same roof effectively 24/7. I mean, that's a melting pot that's caused a lot of grief and anger, hasn't it?
Yeah, and I think that the other thing that's been an eye-opener for a lot of the clients that I've certainly been working with, both as people who've experienced, increasing levels of agitation and irritability, is that the person that they've been in relationships with, all of a sudden they started to see a side to those people that they never saw before. So it's very much uncharted waters. But then the opposite was also occurring for some people who all of a sudden had such huge levels of irritability and agitation that it was a surprise to them. They started actually getting help because they weren't liking who they were seeing in the mirror either.
Right. And going back to the idea of abuse, are we actually seeing more an increase in the incidence of domestic violence?
Yeah, more. My personal thing is I haven't actually seen a lot of physical violence. I've seen the psychological and I've seen the emotional. I've seen the withdrawing, the retreating. I've seen people literally go into absolute shutdown, and partners have felt like they've been on the outer. So while I personally haven't seen actual physical violence, I've seen more where people might have started to increase drinking, and then they've started the actual, verbal assaults, the put downs, all of a sudden things that they were able to probably, channel their energy somewhere else has not been able to happen. And they've actually now all of a sudden, once they've been they've either had some drinks that they probably wouldn't ordinarily have had, they've now gone off and actually started, speaking their mind to their partners. And that's where a lot of the conflict has actually started to arise.
Right. So putting two people together into a pressure cooker who don't necessarily get on all the time exposes a lot of the fracture lines, basically.
Yes, definitely. And that's certainly been what I've seen. And, even a colleague of mine wrote, divorce. That's the theme of everyone coming through her clinic at the moment is divorce.
Yeah. And what about the children?
Oh, look, it was interesting. I was only talking about this the other day. Sometimes people were, well-meaningly putting up lovely things on Facebook of, families happily baking bread together and doing all these lovely family things. But for a lot of people, that only made them feel even worse because that wasn't what was going on in the family. They don't show. A friend of mine was actually saying, they don't show people sitting down there devouring the whole loaf of bread in an effective emotional soothing because they've been rattled by their partner. Weight gain. Oh my gosh, that's been another massive thing. People have come back in and it's like, this is the body that COVID built. They've gained, 10 kilos. People have come back to work and all of a sudden, everyone's complained they've had to go and buy new clothes because they've outgrown their wardrobes.
Yeah. So that's the context. This pressure cooker environment has basically exacerbated everyone's fracture lines, irritability, and it's taken a toll on everyone's resilience. What are the warnings? What are the presenting signs of a frank mental illness? What kind of illnesses do we see?
I've seen more heightened anxiety. So I've actually had clients who have never really, they may have had anxious moments, but I've actually seen clients come down like with more symptoms of actual agoraphobia where they don't want to leave their house. They've gone back to a shopping centre and they can't cope with the overstimulation, which has been really, really quite pronounced certainly for a lot of the clients that I've been working with.
Right. So agoraphobia, what does that mean? What does agoraphobia mean?
Basically feeling uncomfortable in, sort of environments, could be shopping centres, it could be, agoraphobia is the title actually came from fear of the marketplace. Yeah. People just been absolutely, not coping in overstimulated environments. All of a sudden being in too much close proximity with people has been, very unsettling for people. Trying to get back on a crowded bus. I've seen many people like hit the exit and jump off the bus because they've just not been used to the physical proximity of so many people now.
Right. So we're seeing an increase in the anxiety disorders, and in particular, as you said, agoraphobia, and then also presumably we're seeing more generalized anxiety disorder, perhaps.
Yeah, and I know while it was all going on, certainly increasing of OCD type symptoms. So where people are like very petrified of, germs and wanting to wash their hands.
Yeah. What about the depressive disorders? Are we seeing more people with depression in your experience?
Yes, definitely.
Yeah.
If it didn't happen as a consequence of, collapsing businesses, I know for my more mature clients, they've been very concerned about the stock exchange, their superannuation, because of the interest rates coming down, the term deposits that people used to have money in. I've seen a lot of presentation for the more mature person who's very, who's actually quite depressed about everything, but equally also anxious. But certainly, yes, depression. And from my experience with a lot of males, it's been certainly increases in alcohol to manage the symptoms that they're dealing with. They'll just go to their friend's place to, do some carpentry, or they'll just go to someone's house to work on the car. But usually what a lot of it is actually an opportunity to be drinking.
Yeah. So what does depression look like? How do you know that you're getting depressed? I mean, because people don't understand, what that diagnosis looks like and in fact what it means to have that diagnosis.
Yes, and this is a big thing that I've seen so often is people think that depression meets someone literally under the doona and that the person's basically bedbound. And that's only one version of one of the symptoms that can come under the cluster of depression. I have seen people more often than not irritable.
Yeah.
Those people that are kind of agitated, they're not comfortable, they're short fused, they're it doesn't take much for them to get triggered and set off. And then the whole family goes into, feeling uncomfortable and walking on eggshells, and, children are scampering to their rooms trying to, not have to be sitting around the proximity of the person who's, just starts picking and being niggly.
And what about the biological symptoms?
Yeah, so usually it's sleep disturbance. People will either start oversleeping, not getting enough sleep, or their sleep is incredibly broken. They're waking up One of the things I'll often ask ask clients is, do they find it easy to fall asleep? If they're looking at and fluffing the pillows and moving around the doona every 3 seconds, well, that's not necessarily indicative of a good sleep. But same is early morning waking, where someone wakes up and it's one thing to just turn over from side to side and maybe fall back asleep a couple of minutes later. But if we're still sitting there 60 minutes, 90 minutes, 2 hours later, not falling back asleep, that there's another telltale sign. Changes to appetite, overeating, not eating enough, weight gain, weight loss, concentration, just not able to enjoy things, having lots
That's
of
a key
ruminations.
symptom. The lack of joy. I mean, that's a question that I ask patients when I'm screening for depression is, do they have joy in their life? How do you think that a lack of joy, how do you elicit that symptom? What questions do you ask?
So I'll often ask something, are you able to enjoy things? Do you feel like there's been, are you able to look forward to things? And when we think about good mental health, one of the problems that happened with COVID was that the novelness and the new experiences, which is cornerstone to good mental health, people weren't able to do things. Not only could they not go to their local gyms, they weren't able to, the whole thing around dopamine. If someone was going to go, they were looking forward to a really nice meal, or they were looking forward to going camping. Some of these things are really important to get the chemicals of actually looking forward to something, much less the joy that you actually get when you're there. So they're sorts of questions. But the other thing that would come up is feelings of guilt, or feelings that, maybe I would be better off if I wasn't here, or, everything is just such an effort. So when I start seeing things like that, and then of course the presentation, what people say, or if I start seeing there's a discrepancy between, I'm feeling really good, while you see them, clenching or, stretching out their fingers, looking really agitated, so we're looking for lots of little clues like that.
And of course, the ultimate endpoint of depression, and in fact a lot of mental health disorders associated with low mood, is the fact that people start thinking about ending it all. I mean, how do you approach that subject?
I usually call it straight out. I've learned now the best thing to do is not pussyfoot around with the word suicide, but often I'll say something to the effect of, I'll always preface it by saying, look, I work with many clients, and, it's not uncommon that when people are feeling so damn miserable that they will actually have thoughts that they would either be better off if they were not alive, e.g. they've actually been thinking about suicide, or that, maybe if it hasn't got to that if they're in bed and the doona, strangled in the middle of the night, that it wouldn't be such a bad thing. So I'm always deciphering between what's a passive death wish and what's straight out suicidal ideation. Because sometimes people there's a difference between, this is a really a gorgeous psychiatric nurse told me about the distinction between this. Do you actually want to die, or do you just want the distress you're living with at the moment to stop?
Yeah. That's
because there's actually quite a difference in the energy between those two statements, or those two, the way those two questions can be asked.
Do you want the stress to stop, or do you want your life to stop?
Yes, well, again, you have that ability to make it extremely concise, and that's exactly, that's and more often than not, people will actually say, no, look, and of course then I'm always gauging for things like hopelessness and helplessness. If I can still sense that, I just know this is a moment and I do think it's going to get better, then there's always that nice big breath in. But when I hear someone saying, look, no, I actually don't hold too much hope that things are going to get any better, then I'll go straight through to a full risk assessment.
Right. And I think it's important to understand that asking the question about suicide does not actually increase the risk of suicidal activity.
Not at all.
And if we as clinicians don't ask the question, we are utterly negligent. Because a lot of people have this feeling that you're not allowed to broach the subject for fear of triggering something. Well, that's just on many levels an untenable view to have of this issue, isn't it?
Yes, that's exactly right. In fact, some people actually really value the chance to be able to have sort of an objective experience about the enormity of what does suicide mean to them. The relief that some people have got in just being able to say, look, there is a part of me that actually wants to die. And the more that we can get comfortable as clinicians about having these conversations, the more we, sometimes I've had clients just say, look, I'm glad I've been able to park that aspect of myself somewhere. They've got no intention, they've got no plan, but they've just been very relieved to be able to let that part have a say. And I think there's something to be really said for that.
So we'll move on to the addictive disorders, but before we do that, are there any other big psychiatric or mental health disorders that we need to cross off our list of those that are more prevalent as a result of COVID?
No, I certainly do know that the coexistence with substance abuse and mental health has certainly been something I've observed.
Yeah. All right.
But yes, certainly, yeah.
So, okay, so moving on to the addictive disorders. So, in my practice, I've seen an increase in smoking. I've seen an increase in alcohol. And with regards to alcohol, the men show a different pattern from women. Men tend to drink more alcohol because they're trying to cope with the loss of identity that they've experienced as a result of unemployment. Whereas women tend to drink more alcohol because they're trying to cope with the stress of childcare and homemaking during COVID.
Yes.
Because the kids are at home as well. So there are kind of different reasons for that. I mean, what's been your experience with alcohol?
Exactly what you've said. I think there's been a lot of girls who are, even putting stuff on Facebook around, is it wrong to be wanting to have a drink before midday? So I think a lot of my experience, when's the right time to have the first drink? But no, certainly I think you're right. There's, I know a lot of women have become very resentful. And I don't want to use this in a stereotypical form, but a lot of women have actually been really, really niggled at the fact that their partners, if they've still been able to stay in employment, have had the luxury or perceived luxury of being able to get in their cars and shuffle off to work while they've been at home trying to juggle yet another load of washing, another, oh my God, there's nothing in the pantry, kids want something to eat, and then trying to do the homeschooling. And I know a lot of women have been caught up in the comparisons that you've got these other women putting stuff up saying how the kids have got all their schoolwork done, whereas other people have been ducking and weaving around the phone call from the school that was saying, look, you haven't submitted anything online. I know I've had a lot of clients upset because, social workers and welfare workers from the school have been saying, look, your child hasn't been even attending online. Do we have to make a notification to Child Protective Services? So there's been a lot of pressure in an already difficult situation that I think sometimes the systems have also not been in alignment, and there's been mixed information causing a lot of distress, a lot of social comparison that's made people feel very inadequate and certainly less than, and then made themselves feel like, oh my God, I'm failing as a parent, or I'm failing as, as a mother.
Yeah.
And not even understanding the homework. There's been parents that are like, I don't even understand my kids' homework.
Yeah.
It just doesn't make sense.
So parents have had to become almost de facto school assistants, haven't they?
Yeah.
And it's some parents aren't able to do that, and that's no disrespect to them, for whatever reason. And the other thing is, one of the things that I've thought about is the social inequity of this kind of enforced homeschooling. What if you're from a poor family that doesn't have access to the internet or a laptop at home? What do you do then?
Yeah, look, a lot of the schools were very aware of that and did sort of make sure that there was access to get dongles and computers and stuff like that. But the other thing that I would often see is people's, because they were all in their homes, this whole sleep and wake cycle went out the window. Kids were going to sleep at like 11 o'clock, 12 o'clock, midnight. People were all sleeping until midday. I think everyone just did what they needed to do to be able to survive the situation. And that did result in a lot of, everything going back the front. People's eating went skewy. People weren't probably eating the most healthiest things that they would be eating. There wasn't the mood foods went out the window.
So I think it's important at this point to emphasize the actual guidelines for alcohol consumption in Australia. So in Australia, the current recommendation is that you should be drinking no more than 10 standard 10 standard drinks of alcohol in a week, and no more than 4 standard drinks on any given day. Now, a standard drink in Australia has 10 grams of alcohol in it.
Yeah.
So therefore, we shouldn't really be drinking more than 100 grams of alcohol per week. And that's actually quite a stringent target. And I suppose that target has been set because we know that the evidence for chronic disease goes up when you drink alcohol. There's no safe amount of alcohol, but we're trying to minimize the risks for chronic disease, and that was set to minimize the risk of chronic disease at 100 grams of alcohol a week.
Yes.
And the 40 grams of alcohol on any given day was set to minimize the risk of untoward events or accidents, or because beyond that you're more at risk of accidental traumas, etc., etc. And just to put it into perspective, well, what is a standard drink? What is 10 grams of alcohol? So a standard drink, I always think of it as beers. I wonder why that is. So a light beer is about a standard drink, right? And you'll actually see it on the bottle. It might be 1 or 1.1. A medium strength beer is maybe 1.1, maybe 1.23. Whereas a full strength beer can actually be 1.5 standard drinks. So if you put that into perspective, you're talking about 7 standard beers a week.
Yes.
Which is 1 beer a day. And if you're talking about the maximum number of drinks you can drink in a day, so that's 4 standard drinks. So you're talking about 2.5 to 3 full beers a day, and that's exactly it. Right. So when people realize just how stringent these alcohol guidelines are, putting it into that context of no more than 3 beers in any given day and no more than 7 beers a week, it can sometimes be a very challenging guideline to follow. And putting it into context on an international level, so just to reiterate, in Australia, a standard drink is 10 grams, right? 10 grams of alcohol. In the US, a standard drink is 14 grams. And in the US, the guidelines say that you should be drinking, for a bloke, you should be drinking no more than 14 US drinks a week. So 14 times 14 is about 190 something or other. So that's almost 200 grams. So that's almost double the recommendations of alcohol consumption in Australia. So, then that starts bringing it into question, well, where's the truth of the matter? And I think, I actually think that the Australian guidance is really reflecting the risks of long-term harm that we can experience, because we know that alcohol is a carcinogen. We know that it causes heart failure. We know that it causes brain failure. We know that it causes things like testicular atrophy. The effect of alcohol in the body is enormous. It's a poison.
Yes.
And in fact, were alcohol to have been suddenly invented today by one of those mind-altering chemical labs that are constantly looking for psychedelics, if we suddenly came across alcohol now, there's absolutely no way that it would be legalized. It would be banned immediately for all its known ill effects.
Yes, exactly. Yeah.
So that's all the more pertinent when we think about, the effect of alcohol on the body and the effect of COVID on alcohol consumption, because we're beginning to expose ourselves to the risk of all of these chronic ill health problems when we have this idea of, well, what time can you start drinking in the day?
Yeah, that's right.
Yeah, the quarantini actually heralds a lot of harm, unfortunately.
Yes.
Yeah.
That's right.
Yeah. I love that term, the quarantini. So, I mean, we've talked about alcohol, and I've alluded to the fact that people are smoking more. I mean, I don't think we really need to explain just how bad smoking is for you. Everyone knows that smoking is bad for you. But here's a question. Where can we get help? If we can actually understand that actually some of the symptoms that we're experiencing, as you've alluded to, the irritability, the guilt, the lack of looking forward to things, they're not necessarily the typical symptoms that we would experience or expect with low mood or depression. People say, oh, I'm not depressed, but I've got guilt, I've got anxiety, I'm irritable, and I've nothing to look forward to. Having recognized that problem, and having recognized that there's a problem with our alcohol consumption, or for instance, our tobacco consumption, where can we get help? How do we help? How do we seek help?
Look, there's so many resources on governments. There's Beyond Blue. There's, your local doctors are always a fantastic place to start. There's, local community health centres. There's things like your mental health treatment plans. And, understandably, the government did extend the 10 sessions because of the impact of COVID. So they did allow for an additional 10 to, realise that for a lot of people, the therapy sort of, in some ways, the treatment therapy stopped when we got COVID. So if people were originally working on perhaps their PTSD symptoms, when COVID hit, all of a sudden we may have had to change our clinical focus to managing stress and managing anxiety, that the treatment for childhood sexual trauma may have all had to be put on hold while we were dealing with these new set of symptoms and new set of stresses and things that were coming into the clinical room. Or half of us weren't even working in the clinical room. We were, dealing with stuff over the internet and online. And I think that's a really good thing that the government decided to do. But there is a lot of help out there, which is so important about getting it.
Yeah. So just to clarify a couple of things. So the GP mental health plan, the GP MHP, is a very good first point of contact. So seeing your GP and asking for a mental health plan, then what does that do? What does the GP MHP do?
So that will provide, the GPs will have an idea on who they think may be a good person to refer the client to. They'll have a bit of an idea on, my experience certainly with the GPs is they've got an idea on the different clinicians that might be out there and who they think might be a good fit. It also comes down to who's actually taking clients on. I know a lot of clients have not been able to either get into their psychologist or their mental health worker or their clinical social worker because their books are closed. Some people just aren't taking on new patients or new clients.
So the GP will then have a clear idea of the local services that are available. And I think it's really important to emphasize that to access Medicare-funded counselling sessions, you have to have a GP mental health plan. You cannot actually access Medicare benefits to see a psychologist or a mental health social worker without it. So that's that. I mean, you may argue about the merit of that, but that's how Medicare is funded. You must go to see a GP first to get the GP mental health plan written, and part of that plan then states referral to talking therapies, and then the GP will have a list of resources.
Yes.
And before COVID, there was a limit to the number of Medicare-funded sessions. Before COVID, there was only 10 sessions per year, but thankfully the government has now increased that number to 20. So now patients can access, via the GP mental health plan, 20 subsidized sessions. Now, it's important to note that that subsidy is only a subsidy. It doesn't necessarily cover the entire cost of the counselling session. So people need to be aware of that. There can be co-payments, or there can be gap fees.
Yes, exactly.
But that's how we access the government-funded services, is via that GP mental health plan. So there is, however, a kind of an alternative funding stream that the government has put in. And for those who have healthcare cards who cannot afford gap fees, there is a separate alternative funding stream, and it's run by the PHNs, isn't it, Maree?
Yes, that's correct. So they, realise that. So the primary healthcare networks also have a range of clinicians that can also, provide those services, especially for those that, don't have access to extra and funds to cover the out-of-pocket expenses.
Right. So that's entirely bulk billed, effectively. That's what you're saying. Yeah. And it is out, and it does not necessarily rely on a GP mental health plan to actually access those Medicare benefits, but it does still require a referral from a GP, doesn't it?
Yes, that's correct.
Well, Maree, unfortunately, yet again, we've run out of time far too quickly, but I really appreciate your time today. Thank you very much, and we'll speak to you soon. That's all for today's MedHeads. My name's Dr. Fergal Armstrong. We'll see you next time.